Okay, well, the difference between open and arthroscopic rotator cuff repair is simply, are you making an incision to see what you're doing and doing the repair versus arthroscopic portals, looking through a scope and working through little tubes and, keyhole type approach to getting in there. The vast majority of rotator cuffs can be repaired arthroscopically. What I would want is a good repair no matter what. And there have been times where I've had someone who told me, I can't take time off. I'm a welder. I'm going to lose my business if I can't work. And I've done an open repair with a real durable type repair with multiple sutures to try to just make sure that it couldn't pull away and let them work. Interestingly, all of the advantages of arthroscopic surgery were really based on reducing morbidity and reducing pain to allow outpatient surgery, less narcotic use, blah, blah, blah. We've kind of come full circle because we now have modern ways of relieving pain, and we have injectable medicines that last 3 days. And so you can numb a patient's wound up and send them out the door, and it doesn't wear off in the middle of the night, and it lasts 3 days. And so the difference in morbidity between open and arthroscopic techniques really is kind of narrowed, that there's not so much of a gap anymore. So the bottom line is, I think, have your surgeon do what he does well in his hands. If he thinks he's going to fix it better with an open technique, fine. If he's going to fix it just as good through the scope, fine.